As a naturopathic doctor, I get asked all the time what it is exactly that I do and how can I help people. First of all, as far as education is concerned, I have a 4-year medical degree up to the standards of that to become a primary care physician. This means extensive knowledge in clinical diagnosis, lab diagnosis, physical exam, courses in anatomy, physiology, pathology, basically all the same basic sciences that medical doctors go through. But then on top of that, I have extensive training in herbal medicine, homeopathy, physical medicine, hydrotherapy, nutrition, and counseling. So this is what a big part of being a naturopathic school is about, learning these things. So as of 2018, if you live in a licensed state, and those licensed states are listed here, you could go to a naturopathic doctor who is able to take insurance because they're licensed in that state. They can order basic blood work. They can act as a physician, yet at the same time they're an expert in natural health, so instead of simply getting drug prescriptions, you can get someone who's actually helping you with what the underlying issues are. But as of 2018, I'm working in New York State, which is not licensed. So that means I can't take insurance, and there's certain lab tests I can't order. But that doesn't make me less of a naturopathic doctor, and that's because naturopathy is more defined by our underlying principles and philosophy of what we do, much more than any specific licensing was. So right now we have a really huge natural health industry, but just because you do something natural, that doesn't make it holistic. Because you have inflammation somewhere, taking fistfuls of turmeric and fish oil, for example, is not necessarily holistic. That's not really addressing the question of why is your body producing that inflammation? Why does it have that symptom? What do you really need to get well? It's basically just taking some supplement and using it in lieu of medication. So a naturopathic doctor is supposed to be able to use the training in both conventional diagnostics and holistic philosophy to help treat people according to the root problem, not simply using some substance in lieu of medication. I'm going to try to explain what naturopathy is by running through the 6 principles of naturopathic medicine. The first is the healing power of nature. This is simply the understanding that the body has an inherent ability to heal itself. Someone comes in with a symptom, it's not because their body is broken or defective, it's because there's something they need that they haven't been getting. Or there could be some type of toxin, whether it's a physical toxin or emotional stress that they have been getting that they're having difficulty handling. The idea is that if you give the body what it needs, it knows how to heal itself. Holistic treatments should therefore work within the context of the body's self-healing mechanisms. We're not trying to use aggressive therapies in order to override something the body's trying to do. The next principle is to identify and treat the causes. Whether it's migraine headaches or high blood pressure or skin rash, whatever it is, we're not treating those symptoms. We're going to figure out why the body is producing those. And this leads into do no harm. Because one of the big ways that people get harmed through health treatments is because they're giving treatments that are not designed to actually heal them. They're giving suppressive treatments. So if someone has a headache and they're told to take Tylenol for it, the Tylenol might make it look like they're better by reducing pain, but they still have the headache. The underlying mechanism is still there. That's going on, but now you just introduce the toxic agent into them, so now they have another problem. So someone feels better, but they're actually much worse than if they weren't given any treatment at all. So first, do no harm means we want to treat the cause and do so in a way using as gentle modalities as possible. The next principle is to treat the whole person. So for example, if someone has an eczema skin rash, we don't want to just give them some anti-inflammatory for the skin, which is similar to giving them a steroid drug. We want to figure out what's going on within that whole person that's causing that skin rash. Is it related to digestion? Is it related to toxicity? Is it related to nutrition? We're going to get to the bottom of it. And yes, there is overlap between these concepts, such as treat the whole person or treat the cause. And this fundamental issue going on here is that of holism. It's about understanding that one person is a whole unit, and if you help that whole person be healthy, then the whole person is going to be healthy, and we're going to see less symptoms overall as their body simply doesn't need to produce them. Next concept is prevention, and one of the nice things about not using a disease model is we can actually prevent illness. You know, in conventional medicine, sometimes the doctor might see, say, a thyroid condition developing, and you know what they're going to do? They're going to be like, oh, come back in 6 months, we're going to retest this. Or, that's why they keep on doing mammographies or scanning for breast cancer. There's no prevention of breast cancer, but they're going to keep on screening for it. And that's because all their modalities are based upon suppressing diseases, using violent force to get rid of symptoms, such as surgery and cutting things out. But in natural health, we don't need a disease in order to help someone be healthy. Actually, the type of client I like to have is someone who's in a situation where they don't have a disease yet, but something is developing and their medical doctor just wants to retest them every couple of months and have them keep on coming back and waiting for something to happen. I really like it when those people come in and we can take preventative action. Docere, or a doctor as teacher. In conventional medicine, the doctor is someone who comes in from the outside and tries to just take control over someone, and the patient is very passive. With natural health, the practitioner is more of a guide, and it's the patient who has to take a much more active role. Okay, those were the basic principles in naturopathic medicine, but I'm going to add on my personal philosophy. First thing is that everything you say will be listened to and considered, because I hate it if I go to a practitioner's office and I have questions and they just kind of dismiss it like it doesn't matter. All questions should be answered as fully and honestly as possible. So if someone has a question, I will give them a full explanation. If I don't know the answer, I'll say, look, I don't know, because no one's going to be able to know everything. No health concerns should be dismissed as irrelevant. If someone comes in for their headache and they say, oh, I have a rash on my elbow, I'm going to look at that also. And you know what? If you're following a holistic philosophy, everything is connected to everything else. So every symptom can give a clue into what the underlying issue is. So I hate it when practitioners are very dismissive, like, oh, that doesn't matter, let's just do what I want to do. I hate that. I hate it when practitioners talk down to people as if they're a child, or if it's all in your head. Anytime a practitioner acts like it's all in your head, that really means that practitioner just doesn't know what's going on and they don't want to admit it. I hate it when practitioners try to take hope away because a doctor doesn't know what to do. So they're like, oh, there's nothing to do. There's no hope. You just have to live with this. Please, that's ridiculous. The next thing is recommendations without being told why. Whether I use lab tests or herbs or anything I do, I try to tell people why they're doing it. So what is a naturopathic doctor? Well, a naturopathic doctor is someone who's able to combine knowledge of conventional diagnosis and more modern scientific understandings of what causes illness with traditional holistic philosophy in order to become an expert on health, healing, and what the body needs to be well.